Mental health among youth in Uganda is considered a significant public health concern, with high rates of depression and anxiety reported, particularly among secondary school and university students. According to Dr. Juliet Nakku, the executive director of Butabika Hospital, the commonest forms of mental ill health among the young people in Uganda include anxiety, depression with alcohol and substance abuse taking a lead.
We are seeing a lot of what we call the common mental disorders, and these are particularly depression, anxiety, and sadly, alcohol and substance abuse. This problem is becoming almost an epidemic in this country. Our young people are drinking a lot and using a lot of drugs which are very dangerous, which have very strong drugs on the street like heroin, cocaine, crystal meth, but also cannabis and cat, and many more that are not commonly seen.
Dr. Nakku explains that the challenge of alcohol and substance abuse begins as early as primary and secondary school, with reports indicating that negligence from both parents and teachers contributes to this issue. She emphasizes the need for proper guidelines, actions and interventions to be put in place to address the problem.
It doesn't start when they're adults. It actually starts when children are still young, especially in schools. In a recent study that we did for Ministry of Education last year, 2024, we got a lot of voices from the schools, from the children themselves, from the teachers, both primary and secondary, about the challenge of alcohol and substance abuse. This is where the problems are starting. And if we don't deal with this, if we don't have proper guidelines and actions and interventions right at the school level to help our young people, this is why we end up now with graduates who are not functional.
In his address on 3rd February 2025, police spokesperson Rusoke Chituma commented on the growing challenge, urging school administrations and parents to conduct thorough checkups on the luggage carried by students. He highlighted that students often smuggle dangerous substances and items such as drugs and knives, which pose a serious threat to their safety and the safety of others.
Hence, we call upon you because in our policing environment, we have come across students who have come in conflict with the law using weapons they smuggled into school, like knives, then drugs. I will re-echo the issue of drugs because as law enforcement officers, we know that the challenge of drugs is serious and really needs to be paid attention to. They smuggle in Cuba, they smuggle in all sorts of, even liquor. Some students smuggle alcohol into schools.
Regarding the prevention of mental health challenges, educating the young people and raising awareness of the future challenges they are likely to face are some of the solutions suggested by Dr. Nakku.
Educate the young people to raise their awareness of the challenges they may have or they may face in future. Educate them, but also help them to develop resilience, to know what is right and what is wrong, and to be able to overcome adversity when they meet it, and they don't use adversity, or rather drugs of addiction, to treat the way they feel because of the adversity that they face.
Along the process of containing mental health, there are a number of challenges as explained by Dr. Nakku.
We need to educate the masses. We need a drive to get people to know in the first place. Once people know what it is that might happen, what it is they're suffering from, it is easier either to avoid it or at least to get help. The lack of professionals is also a big challenge. We are very few to handle this country. And this is where technology has now come in to help. We're trying to see that we can use technology to be able to reach out to as many people as possible. And we hope that helps.
She finally urged Ugandans to try and educate themselves about mental health, saying this would be the #1 step of addressing the challenge. She also wants the government to increase the budget for health to enable the hiring of more health workers.
My call to Ugandans is to try and educate ourselves about mental health, to spread the gospel about the importance of mental health to health, and to government to provide support, to put up services and facilities that will reach everyone in the country. There is good attempt actually, but it is work in progress. We need to do more. We need to do more to train providers who are going to reach out to everybody, to provide the resources, to even provide the environment in which people can be treated.
John Baptista Humza, Church of Uganda, from the TV News at 8.